So then let me move the conversation along to this then, like, which might be slightly dicey in Singapore, but how culpable should the government be or institutions be in mitigating inequalities and racism? And and I mean, what do you think of the idea that is usually thrown around, which is we've got limited resources and therefore that is all we can do for others? Like talk to me about that. How culpable should governments be? And on the flip side, how culpable should we be as a human race? Um, like like how how much depends on us? How much depends on the government? Of course, the answer is both, but kind of talk to me a little bit about that. What needs to change in order for us to see uh, um, more equality?
Estelle, you want to say something? I, I'm ready to say
No, I
100%.
do
Go,
not.
JC, go.
Go.
He's ready to go. He's like,
100% culpable.
mm,
Both of us. I mean, the government, where it's not a dictatorship, hopefully is elected by the people to represent the well-being of all the people. Um, and so my starting point is kind of the human race, right? We're all in this, and so we all deserve dignity and access to the resources, and then the way that our life is structured is that we have governments who we entrust that responsibility to carry that out. And so then I would say 100% culpable or
mm,
responsible for doing that. And so that's my starting point. And then in terms of like there aren't enough resources, I think that that's a myth. I think that it's just a matter of how those resources are distributed. Um, we see that just, open Forbes magazine every year, and there's a list of the 100 billionaires, the 100 richest people, and so how is it that in 6 years Jeff Bezos from Amazon is going to maybe become a trillionaire? It's like, how does that person accumulate that wealth? Well, it's from all the warehouse workers who are actually taking the
mm,
orders, putting them in boxes, being infected by COVID, and then when they protest about their circumstances, they're fired. Um, and so the resources are there. The resources, I think, globally are there for everyone, but we live in a certain system and structure that doesn't distribute those in a way that is accessible to everyone, or is I would say just for everyone to access.
mm. Any of you want to chime in?
Well, I think I just like have a story that that came to my mind when Chris was talking about Central Park and the white people hanging out there. And so there's like access to sunlight and fresh air. But just thinking about access to medical services. So one of the things I did at SG Accident a few days ago is that I had to call all the migrant workers who were injured and to ask them like how they're doing. So just to check in. So I called a bunch of them. First of all, it's really hard to communicate because of the language barrier. But then I asked a question, just a simple question like, when is your next doctor appointment? And like, are you okay to get there? And almost all of them said that, oh yeah, our appointment is like in a couple of days, but we cannot go. And I was like, what do you mean you cannot go to a doctor's appointment when you have like a serious injury, like it's a follow-up or a physiotherapy appointment or to extend your medical MC, your medical certificate? And they think that they cannot go to the doctor because of the lockdown or the circuit breaker, which is not true. You can go to the doctor, especially if you have an appointment that has not been cancelled, right? The hospital didn't call you to cancel it, means you can go. But they have this impression that they cannot, and they're afraid to do it because there have been stories of people, of their own people who have broken the rules and then got deported immediately, right? And so these are injured workers. They're not going to do it just to be safe. But that means they don't have access to basic health care. And in contrast, my dad today just went to the doctor for his regular like medical appointment and checkup. He has no fear because he knows that he can, and there's nothing wrong with it. He has an appointment card, so he's not going to get like caught or anything like that. So I mean, like, as I've been reflecting on like the vast difference between my father, who is a Chinese Singaporean, versus a lot of the migrant workers I've talked to who are Bangladeshi or from India and they don't speak English. It's a matter of the system, not explaining it to them, but also the people around them. I mean, their bosses, the agents, the hospital workers,
Right.
people in the organizations like SG Accident Help Center need to be calling to say like, you can go, it's not an issue, please go, because if you miss your physiotherapy appointment, then you will not get better. So yeah, your question about like, is this a system thing or is this a people thing? I mean, like JC said, it has to be both.
Yeah.
The system needs to be clear and it needs to be fair. And thankfully in Singapore, about 75% of the time it is. But the way it's communicated or the way it is executed on the ground, that it is not fair.
Yeah, because there is a power differential. And I know I said this earlier, but I just feel like I want to stress it again, right? Because people keep thinking, oh, we're providing the policy, so it's there. They have access, but they don't have access because they fear. And they don't dare to ask for access, because your story is one of many stories I've heard from other volunteers as well. Like, we provide counseling, but they don't dare call in for their counseling session because they're afraid their boss will feel like they're slacking off and they'll lose their work. So there's just so many conditions of fear that make them unable to access help. It's just not as simple as just providing the policy.
Right. Or they call in and try to get help, but it's not in a language that they can understand. So we cannot assume that everybody in Singapore can speak English. Okay, that is not true anymore. So if you want to be a nation that hosts like hundreds of thousands, actually 1.1 million foreign workers, then you better have the systems in place to be able to speak Mandarin, Bangladeshi, and Tamil, or any Indian dialect that is most used among our migrant workers. Yes, JC, go.
I think the other thing too there is, because you're saying, oh, the resources are there, there's fear, I think a lot of times the narrative you hear is, well, we provided it, why didn't they? But on the flip side is that the system has reinforced their fears aren't unfounded, right? It's been reinforced that there's punitive actions when they've actually tried to access it, or the language that's used broadly is, you're living off of us, and so already they've internalized the reality of what people say, what people think, even though then there might be access to certain things. So here in the US, the national rhetoric towards undocumented folk or people who lack resources or economically isn't, you're stealing from us, you're stealing from the people of this country. So then when local governments do provide access, a lot of people are afraid to actually go and access that, especially when the federal government has said with other programs, if we find out, then there's going to be punitive action towards if they're trying to get like citizenship here. And if we find out that you had access like help from the government before that, then we won't allow you to become a citizen. So then now when, local governments are providing help, they're like, I don't know that I can or I should. So again, the fear isn't just some sentimental thing that they're afraid, right? It's actually reinforced by the system. It's founded fear.